Okay, so we're going to go over the female reproductive system here. And we're going to look at the female reproductive organs, learn their combining forms, explain how the hormones function. Don't stress too much over the hormones. We're going to look at abnormal conditions of the reproductive system and also pregnancy and newborn. Describe important laboratory tests, clinical procedures, and abbreviations that may go with that. Again, don't stress too bad over the abbreviations. We're going to understand the medical terms in the proper context and be able to utilize those. So do know your combining forms, your prefixes, and your suffixes. In addition to your word components and being able to build and break down those words, a couple other things I want you to know. From the anatomy, fimbriae are the little finger-like projections on the end of the fallopian tubes. So fimbriae. Gestation is the process of pregnancy or the period that you are pregnant for, which is about 40 weeks. Menarche is a non-decodable word, and it is the very first pregnancy at puberty. Very first menstrual cycle at puberty. Lactation is the process of releasing milk. So when a woman is nursing and feeding her baby through the milk from her breast. Again, I want to clarify, menarche was the first menstrual cycle at puberty. Under procedures and pathologies, there are some that I want you to be familiar with here. Abruptio placentae, and it is pretty much exactly what it sounds like. The placenta, which is the structure that connects baby to mom's uterus and mom will provide blood and oxygen, it abruptly tears away or separates, and that can put baby at risk of not getting the blood and oxygen and nutrients that it needs, and mom can have some spotting of that blood there. So abrupte placentae, premature separation of the placenta from the uterus. I do want you to be able to be familiar a little bit with the calculation of gravida and para. So gravida and para, gravida means pregnancy and para means deliveries, and you'll see in the presentation how we would calculate how many gravida and how many para a woman has had, how many pregnancies and how many deliveries. I used to get those terms mixed up, so if you want to remember that they go in alphabetical order, you have to be pregnant, gravida, before you can deliver that baby, para. Cephalic version is the turning or the position. And cephalic, we would like the baby to be presented, cephalic presentation pertaining to head down is how the baby will be prepared to exit the birth canal. So if the baby is not head down, then we can turn the baby, cephalic version. Dilation and curettage, commonly abbreviated D and C, is dilation. We dilate the cervix or the opening to the uterus, widen it out, and then curettage is scraping. So we can scrape the inner lining of the uterus, and there's many different reasons we can do that for. Endometriosis. Osis is an abnormal condition. Endo is within, and metro is the uterus. So it's an abnormal condition of the inner lining of the uterus. And that abnormal condition is that the inner lining is elsewhere in the body besides lining the uterus. It can be a very painful condition. Episiotomy, tomy we know is to cut. Episio is the vulva or the external genitalia in a female. They used to do episiotomies a lot when women would deliver, and the thought was that this would prevent tears when they were delivering, so that they would not tear and we could easily sew up the area that we cut. They found through research that it actually causes it to tear further, and that the cut that we make then furthers into a deep tear. Gynecomastia. This is a condition of gyneco-female, masto, breast, condition of having female breasts in a man. And so this is due to hormonal imbalances. It could be because of their hormone levels or because of medications that have altered the hormone levels. And then a man could develop female style breast tissue there, and usually once the hormones are corrected, that will reverse itself. Hydrocephalus is a condition of water or fluid in the head. It's really surrounding the brain there, and we'll see that on an infant in this presentation. Ovarian cysts. Cysts are fluid-filled sacs, and so these are little fluid-filled sacs on the ovaries. Palpation is the process of feeling. So if we were palpating a woman's abdomen, we could feel for where's the baby's head, where is the baby's bottom, how large is the uterus, how big is the baby. Pelvic inflammatory disease. So this is inflammation in oftentimes the fallopian tubes, often caused by infection, could be sexually transmitted diseases or sexually transmitted infections. And by causing inflammation in those fallopian tubes, it can affect the process of the egg and the sperm passing and meeting up, so it can affect with fertility. So watch for those as we go through. So introduction to the female reproductive system. Sexual reproduction is the union of the ovum, which is the female egg, and the sperm from the male. And the ovum and the sperm are called gametes, or gamete cells. And so those are our sex cells, and their job is to carry half of the DNA makeup. So our chromosomal DNA makeup is there. And the ovum and the sperm each carry half, so that when they join together, we have a full DNA chromosome makeup for a new life form. So the gametes, as I said, is the ovum and the sperm cell. Females have the ovum eggs in their ovaries, and we'll talk about males in the male reproductive system with the sperms. So these gamete cells are produced in what we call the gonads, and in females, that is ovaries. And in males, the counterpart is the testes, or the testicle. So usually there are 2 ovaries and 2 testicles. So fertilization is the process of that sperm and that ovum uniting. That's called fertilization. And then it gets a little technical here. Don't stress too bad over that. But when we have a fertilized egg, it's technically called a zygote. And then it starts to divide and continue to divide those cells and multiply. And it actually looks to implant, hopefully, in the uterine wall. And so from week 2 to week 8, instead of a zygote, we call it an embryo. And then 8 weeks until delivery, usually 36, 38, 40 weeks, we call it a fetus. Don't stress over the technicalities of those different names. Gestation is the process of pregnancy, or the term of pregnancy. So it is 36 to 40 weeks for humans. So lots of different hormones I'm going to expose you to in this chapter. Again, don't stress too bad over the hormones. But estrogen is, both male and female have estrogen, but it is responsible for the secondary sex characteristics that develop in females. And progesterone, so ON is a substance or a hormone, and it is pro for gestro pregnancy. So progesterone is the hormone that sustains pregnancy, gets the uterus ready, and supports that pregnancy. Obstetrics is pertaining to the specialty that deals with pregnancy and eventually delivery of that baby. Neonatology, logy is the study of, new, nato is birth. So the study of newborns, or the care of newborns, the specialty with that. So here we're going to go through some anatomy. You guys have this in your books. And so with this, we're looking at a side view of the female pelvic area, and the reproductive glands are in there. You can see the ovaries. You have 2 of them. This is a cross section, so we're only seeing 1 of them. And the combining form is oophoro, which oo is eggs, or the ovum, and phoro is to carry. So the ovaries are what carry our eggs or our ovum. The other combining form is ovario. And then in this picture, it makes it look like the ovary is connected directly to the fallopian tube, but it is not directly connected. There is a space in there. So the fallopian tubes then is the passageway from the ovary down to the uterus, and the combining form is salpingo for that. The uterus, or sometimes we commonly call it the womb, and that has many different combining forms here. Hystero, metro, metrio, and utero are all combining forms for the uterus or the womb, and that's where we hope the baby will mature in there during the pregnancy. There is a little area between the uterus, and here is the rectum and anal area. So there's a little area in here that we call the cul-de-sac, kind of looks like the shape of a cul-de-sac. Culdo is the combining form for that. So we had the ovaries, the fallopian tubes, the uterus, and now we come down the neck of the uterus, or the narrowing of the uterus is called the cervix. Combining form cervico means neck. So it can be the neck of the body, or it can be the neck of the uterus. Then we have the vaginal canal here, or the vagina, and that is vagino, makes sense, but people tend to forget the other combining form here is colpo. So make sure you remember that one, because when we do a colposcopy, visually examine the vagina there. We have some lubrication glands here, the Bartholin glands. The clitoris is sensitive tissue that is also present there. Perineum, or perineo, is the area between the vaginal opening and the anus, that skin region there. Now we can also look externally at the external genitalia, which is known as the vulva. Vulvo is the combining form. Also episio, and I mentioned an episiotomy. So with an episiotomy, we used to make an incision from the vaginal area, the birth canal, out to the side here towards the anus. And like I said, we hoped that that would prevent tears, but we found that wasn't the case. So again, you can see at the top here, the mons pubis, where hair is. Then you have the clitoris, you have the vaginal opening. It may have a little tissue covering their hymen. Oftentimes that is ruptured with the use of tampons or sexual intercourse. The Bartholin glands are lubrication glands, and the area between the vaginal opening and the anus, again, is the perineum. So that is your female reproductive anatomy. Clicker question here for you. Inflammation of the external female genitalia. See if you can build that word. Would be vulvitis. Here's a cross section, so you can see that you have two ovaries here. The fallopian tubes are not attached. There is a little bit of a space there. And here you can see the fimbriae, the little finger-like projections. So that was a term that I wanted you to be familiar with. And in the ovaries, here you can see the different follicles, and as it matures, we have the corpus luteum and the ovum. So as the eggs mature and rupture there. There are little ligaments that keep the ovaries attached and in place here. And of the uterus, we have multiple layers here. So we have the endometrial lining is the inner lining, and that is what is actually shed when a woman has her menstrual cycle. So if they're not pregnant, that lining actually sheds out along with some bleeding. The muscle layer here, the middle layer, is the myometrium, the structure of the muscle of the uterus. So different layers there. We have here, you can see the vagina again, and the cervix, the neck of the uterus. The top of the uterus, opposite the vaginal opening, is called the fundus. The opposite of an opening of an organ is the fundus, and we will feel the fundus and where its growth is to see how far along with the pregnancy a woman is. Also part of the female reproductive system is the breast tissue, and with that then, once the body is designed to become pregnant, nurture and mature that baby, and then when that baby is born, designed to nourish that baby if that is the choice of the mother. So they can breastfeed that way. The breast is mostly made up of fatty tissue, but then we also have these glandular tissue and this lactiferous ducts. Lactiferous means pertaining to carrying milk, little sinuses. On the external side, you can see the nipple is the papilla, and the colored area around it is the areola. Now, we've talked, I believe, about epithelial and how epithelial really means pertaining to upon the nipple, but epithelial was all of our surface skin tissue. So which of the following is a combining form for the uterus? Metrio is correct. And salpingo was the combining form for the fallopian tubes. Gyneco means female. And euphoro, ovary. Which of the following is the combining form for the nipple? Thealo. And masto is breast. Mammo is also breast. So don't get overwhelmed by this slide here, but this will help show you what's happening with the hormones and with the female body here. So our menstrual cycle, the menarche, is a non-decodable word, which is the very first menstrual cycle at puberty. Now we're going to look in the ovary here at the top what's happening with the ovum or the egg to mature that and get ready to release it. And then we're going to look in the uterus what's happening to get ready for a pregnancy. So we have hormones that impact both of these. And in the ovary, the ovarian follicle or the ovum, the egg, is maturing here and releasing the ovum, the egg, and it's called here the corpus luteum, which actually means yellow bodied. It has this hormone that is surrounding it that is kind of yellow in color, and that is going to nourish and support that ovum as it travels down the fallopian tubes, which takes a couple days for it to occur. In the meantime, the uterus is getting ready for a pregnancy. Your whole body, the reproductive system, is meant to reproduce and to sustain that pregnancy and new life form birth. So the endometrial lining is thickening up in the uterus, beefing up, trying to get a nice bed for this egg, this ovum, to hopefully be fertilized and implant into the uterine lining. So as this egg is released, it's starting to use up that corpus luteum, that hormonal, as it travels down the fallopian tubes, and hopefully it's going to meet up with the sperm, become fertilized, and implant into that endometrial lining. If that egg is not fertilized by a sperm, then the hormone levels will drop off and we will shed the endometrial lining of the uterus because it is no longer needed for a pregnancy, and that will be a woman's menstrual cycle. Then the next month we will start all over again, beefing up that endometrial lining, getting an egg ready, trying to produce another pregnancy. So that's where our menstrual cycle occurs. On average, this occurs about every 28 days. So if a pregnancy occurs, then hopefully this egg travels down the fallopian tube, meets up with the sperm, becomes fertilized, and finds its way to the endometrial lining for implantation. That's what we're hoping will happen. And when that happens, then we start to form a placenta, which is that tissue that forms between this endometrial lining and the umbilical cord to the fetus there. And there is a little bit of different layers here. There is an amniotic layer and a chorionic layer of the sac that is around this baby here. And we can actually do tissue sampling. We try not to. There's better tests now that are less invasive, but we can test the amniotic fluid or we can test the chorion for DNA genetic material. Now, this chorion makes human chorionic gonadotropin hormone, or easier said, HCG, and that's what we will find in the urine or the blood of mom, which will turn the pregnancy test positive, as telling us that there is a fetus there. So pregnancy, we said, was the suffix gravida, and we now have the hormone progesterone, which is pro-pregnancy. It's going to help with that placenta and nourish and support that. And here is a little uterus, normal, non-pregnant woman, and it sits right above the bladder, and it's down in that pelvic cavity. This is the intestines, because we're seeing a side view in here. We have the stomach, the large intestines. Here is the liver and the diaphragm, the lungs. Now, as this baby progresses, this is about 20 weeks, and this is about 30 weeks pregnant, and remember, up to 40 weeks can be full term. So as this baby grows, the uterus grows, it starts to compress our intestines, it starts to push our stomach up, it starts to push the liver up into this diaphragm, makes it harder to breathe, may experience some constipation, may experience some back discomfort, may experience some constipation as we're putting pressure on the intestines and displacing them, may have frequent urination or incontinence as the baby is putting pressure on that bladder. So pregnancy or gravida is the suffix. Now, when we're ready to deliver that baby, there are 3 phases of labor. First, your body needs to dilate the cervix, the neck of the uterus, and we like to get to 10 centimeters is full dilation. It will actually efface or thin out as well. Once you are fully dilated and effaced, you will be having contractions to get that going, but then you will have contractions to birth the baby in cephalic position is our goal, head first. Once the baby is delivered, then we have to deliver the placenta, and we look for that to be intact so that we don't have any retain of pregnancy in there. So here's a clicker for you. Which of the following is a combining form for pregnancy? Gravido is correct. Gravida is the suffix. Gravido is the combining form. Gyneco, we said, was female. Meno is menses, menstrual cycle, and parto is delivery. So hormonal interactions here, don't stress over this too much, but from the hypothalamus up in the brain, we have gonadotropin releasing hormones, which are going to cause us to have follicle stimulating hormone and luteinizing hormone. Here, they're listed here in the middle, and that will help get that ovum ready. The pituitary gland is also where that FSH and LH come from, and here it is. It's maturing that ovum, causing ovulation, release of that ovum. And when that ovum is released, remember, it has that yellow body, that corpus luteum, that is going to nourish and support it as it travels down the fallopian tube, hoping to be fertilized by a sperm. So it's also going to produce estrogen and progesterone to get ready to support that pregnancy if the egg is fertilized. Now, the pituitary gland stops producing follicle stimulating hormone and luteinizing hormone when we are pregnant, and also some oral contraceptives prevent that so that we don't have ovulation or we don't support that pregnancy. So menarche, we said, was our very first menstrual cycle, as opposed to menopause. Pause is the cessation or the stopping of menses. So at menopause, our estrogen levels tend to fall, and with that, we can have symptoms like hot flashes, insomnia, and even vaginal atrophy, or a little bit of wasting away and drying of the vaginal cavity. So menopause is technically defined as 12 months without a menstrual cycle, without a pregnancy in there. Usually happens about middle age, maybe around age 50. It's going to be tightly related to when your mother went through menopause. Now, at that point, some women choose to go through estrogen replacement therapy. In the last decade or so, we have come up with some risk factors of being on hormone replacement therapy for menopause. It can be beneficial in that it delays osteoporosis, but can put us at increased risk of breast cancer, endometrial cancer, stroke, and heart attack. So this is something you definitely do want to talk to your physician when the time comes with that.